Okay, so this is neoplasm part 2. So the topic for today is pathway of spread. So malignant tumor spread by three pathways. So what does this mean? That it means that what are the different ways in which a tumor can spread in our body? A malignant tumor can spread in our body. So there are three routes: hematogenous, lymphatic, and seeding within body cavity is also called transcoelomic spread. So hematogenous, as the term suggests, through blood vessels; lymphatic, as the term suggests, through lymph vessels; and seeding within body cavities, that we will study later. So hematogenous, the important point here is that it is preferred by sarcomas. Second, lymphatic, it is preferred by carcinomas. And transcoelomic spread, transfer of tumor cells from one serous or mucous surface to another by direct contact. Okay, that is called transcoelomic. So the example is carcinomatosis. So this is just a general example, not important. Now there is one more type of tumor, one more type of transfer of tumor, that is called transmissible tumor. So transmissible tumor, it spreads by direct physical contact between animals of same species. So for example, TVT of dogs, transveneral tumor of dogs. Okay, very common tumor in dogs. Okay. Next is etiology of cancer or cause of cancer. So there are two causes: extrinsic and intrinsic. Intrinsic causes includes hereditary. Hereditary includes these three type of cancers, not so important. We just have to learn the names of the factors. Age, so malignant tumor, cancer of old age. And cancer age in cattle is 8 to 10 years and dog is 5 years, and cattle cancer age can be defined as the period of life at which cancer appears. Okay, very easy. So congenital tumor like nephroblastoma, sarcomas appear in young animal though. Okay, so not that. Okay, now pigmentation. Melanin protect the skin from sun rays. That is why the malignant melanoma is very frequently seen frequently amongst in gray and white horses, because they have less or no melanin. Okay, that is why. Next is extrinsic factor. So these are the extrinsic factors: chemical, radiant energy, chronic irritation, hormone, parasite, and oncogenic viruses. That is cancer causing viruses. Next, this topic is important: grading and staging of cancers. So a tumor grade. So they will study two terms here: grading and staging. So a tumor grade and tumor staging. So a tumor grade is assigned to provide some indication of how similar or dissimilar the neoplastic cells are to their counterparts. What this means that is, uh, sorry, it means that how much these neoplastic or tumor cells are similar or dissimilar to their normal counterparts, the normal cells which are present around them. Okay, that is anaplasia in case of malignant tumor. Okay, now grading of cancer attempts to form some estimates about its aggressiveness or level of malignancy. Okay, so now later we will study that staging is a better method than grading, so we will just see in that discussion why. Now, all grading schemes evaluate the degree of differentiation within tumor cells. So it can be of three types: low, medium, high, or grade 1, grade 2, grade 3. Very simple. Now, how is the cancer staging done? So, cancer staging is done on the basis of these three factors. So, if we talk about these three factors, then these three factors are combinedly called TNM system of cancer staging. Not grading, sorry, staging. So TNM system of cancer staging. So T means primary tumor, N means regional lymph node, and M means metastasis. So primary tumor, T1, T2, T3, T4. It means that increasing size of primary lesion. That means T1 is the smallest. T1 means that the primary tumor is the smallest in size, and T4 means that it is largest in size. N0, N1, N2, N3, it means that advancing lymph node involvement. So regional lymph node is also being involved in these, in the tumor formation. And metastasis, M0 and M1. So M0 means absence of metastasis, and M1 means presence of metastasis, distant metastasis. Okay, now when compared to grading, staging has proved to be of greater clinical value. Why? Because in staging we are using clinical test to diagnostic test to actually diagnose or check whether this person is actually suffering from a severe case or malignant or benign tumor. Okay, this topic is not that important. So next is pathology of various types of tumors in domestic animal. Very important. So connective tissue tumor, they can be of two type. Any tumor can be of two type: benign and malignant. So benign suffix oma is used, and malignant suffix sarcoma is used, as discussed in the first lecture. Now fibroma and fibrosarcoma, we are discussing the tumors of connective tissue. So first is fibroma and fibrosarcoma tumors. So fibroma and fibrosarcoma, so this is the benign tumor and this is the malignant tumor, and this is the benign malignant tumor of what? Fibrous connective tissue. So fibroma can be of two types: hard and soft. Hard when collagen fiber is more, and soft when collagen fiber is less. Color can be white, yellow, white, pink. Now polyps, there is a separate category within fibroma and fibrosarcoma of tumors that is called polyps. So if soft fibroma involving the mucous membranes, okay, polyp means that the fibroma is of soft type and it involves the mucous membrane. It is fibroma, not fibrosarcoma, it is fibroma, and is of soft type and it includes the mucous membranes. Okay, this point is also kind of important. Gingival fibromas are extremely common in dogs. Gingival means around the gum line. They are found the gum line and the form called as epuli. Okay. Next is myxoma and myxosarcoma. So myxosarcoma, we can learn it by the synonym, by the abbreviation MMM. So that is triple M. Triple M means that myxoma, myxosarcoma, mucin. So mucin producing cell causes, in mucin producing cell, myxoma and myxosarcoma takes place. So tumors of connected tissue capable of producing mucin. Okay, and since they produce mucin, the cells, since these tumors takes place in those cells which produce mucin, so these tumors are moist and slimy in nature because of mucin. Lipoma and liposarcoma, fat tissues or adipose tissue. Chondroma and chondrosarcoma consist of tumors of neoplastic cartilage cells. So the tumors of cartilage. So it occurs in every place where cartilage is present. For example, epiphysis or long bones. Okay. Next is osteoma and osteosarcoma. So it is the tumor of bone. And now tumor of bone, these are very common in dogs and cats. Whether osteoma or osteosarcoma are common in dogs and cats, but not in other animals. There are animals that is rare. Okay. Now tumors of blood vascular tissue or endothelial tissue. There are two types: hemangioma and hemangiosarcoma. Hemangioma, it is of three types: further, capillary, cavernous, and solid. So in capillary, there is normal uniform capillary seen. The capillary will look normal. In cavernous, the capillary will be highly dilated, and in solid type of hemangioma, the capillary will not be present. It will be a solid mass without any lumen. Okay. Next is hemopoietic neoplasm. So hemopoietic neoplasm are of two types: myeloproliferative disorder and lymphoproliferative disorder. So myeloproliferative disorder means that these affect the myeloid cells of myeloid cell lineage. Myeloid cell lineage, that is chain of myeloid cells which include RBC, WBC and platelets. On the other hand, lymphoid proliferative disorder affects the lymphoid cell lineage, that is B cell and T cell. Okay, and these are the various examples which you can learn if you want to. Now this page is important: leukemia. So leukemia is a neoplastic disease involving different types of hemopoietic tissues. Okay. Now three conditions can arise here. That is TLC, that is total leukocyte count is extremely high, which is the most common case in leukemia. Now it can be normal, which is rare, but extremely rare case is that TLC is extremely subleucemic. That is the RBC, WBC count is very low in case of leukemia also. This condition extremely rare. Leukemia are of two types: acute and chronic. Now tumors of muscle, so smooth muscle, leiomyoma and leiomyosarcoma. This should not be confused with lipoma and liposarcoma. Lipoma means and liposarcoma means lipids. Okay, fat, tumor of fat. So leiomyoma, leiomyosarcoma, and skeletal and cardiac muscle, rhabdomyoma, rhabdomyosarcoma. Benign and malignant of skeletal and cardiac, skeletal, cardiac, malignant. Okay. Next is tumors of epithelial tissue. So for example, benign tumor of stratified squamous epithelium, it is called papilloma or wart. Stratified squamous epithelium, carcinoma cell, squamous cell carcinoma, and common in older animal in horse and eyes. Okay. Basal cell of hair and skin, the tumor of basal cells of hair and skin is called basal cell carcinoma because it is a epithelial tissue origin. If it is of epithelial tissue origin, so carcinoma, and it is a malignant tumor, so that is why also carcinoma. And glandular epithelium adenoma, benign, and glandular epithelium adenosarcoma. Why? Because of malignancy. Okay, thank you.